everybody, welcome to Wednesday Wisdom. So for today, we are going to be trying to do something a little bit different. So a lot of people don't know, but we're in the process of developing something called Osteo and Physio Events, which provides an online monthly subscription package for businesses. So we're wanting to promote osteopathy and bring it into the workplace so that we can enhance changes, physical well-being, mental well-being outside of the treatment room. So this is something that we're developing. One of the elements is monthly seminars from myself in regards to the body, expert knowledge being shared on the body, and a variety of topics that are recommended and advised for different people in the workplace, and also what people would like to hear about. So I'm going to be sharing a little taster on one of the seminars that I've done for that for you today for Wednesday Wisdom, so something a little bit different. So today we are going to be covering and we are going to be talking about osteoarthritis. As we see this a lot in clinic, it's talking about what it is, how it presents, what are the main triggers, what are the main causes, and what you can do to help yourself long term. So osteoarthritis is defined as a condition of impacting and affecting the joint surfaces and cartilage in the bone and underlying bone. So what I mean by that is it's not typically a progressive disorder where we're getting wear and tear and degeneration within the joints of the body and the surrounding cartilage structures as well. It is the most common cause of arthritis, and it is more common as people get older. So as we go through life and we have different falls, different traumas, different accidents, it can put different pressure onto joint surfaces. How the body can deal with that mechanical stress is having to adapt, and this is where we can wear away joint surfaces. Bony fragments can form, we can lose also that lovely soft tissue support, and then we can start to get a variety of symptoms. And so the most common primary causes of osteoarthritis that we see in clinic, i.e. why it comes about and why people are experiencing the symptoms of osteoarthritis in the body, can be linked to a history of joint injury. It can be linked to weight changes, so obesities are putting more pressure through the joints. It can also relate to your work, so if you've got a very physical job, so manual work, if you're either lifting or repetitive awkward positions or excessive pressure through the joints, that can force it to adapt, and that's where it can arise as well. Secondary can be also linked to different conditions. So if someone's got an underlying inflammatory condition, for example, rheumatoid arthritis, over time, as the body adapts to that, it can also impact and wear away the joint so that we can start to get the symptoms of osteoarthritis. It most commonly occurs due to morphological damage to the tissue. So all that means is over time, as we're getting that damage and that wear and tear, the body has to adapt to this. And so what typically happens is we lose that lovely articular cartilage along the bone, which helps have that nice smooth movement. We typically get inflammation and damage to the synovial capsule, so the thing that produces fluid within the joint. So we lose that amount of fluid in the joint, which means bone on bone, increasing that stiffness and restriction. What we get is fibrosis and thickening of the ligaments around the joint, so they then adapt to that excessive pressure or abnormal positioning. And then what we also get is little bony fragments typically forming as well. Again, side note here, people suffering with osteoarthritis, they can actually be asymptomatic. So we might be have people coming in and having results from an x-ray that identifies wear and tear or osteoarthritis and actually might not have any symptoms at all. On the other end of the spectrum, be quite severe and have really kind of changes to the joint congruency, changes in the position of the joint. We get really significant stiffness, soreness, and restriction, as well as bony fragments forming. So there is a complete kind of scale of symptoms, and it's never that clear cut that one person will present the same way as someone else. So it's very, very diverse. The main signs and symptoms that people get, if they are symptomatic, so they're not asymptomatic, is pain deep and around the joint. They typically get that loss of mobility and balance. They sometimes can feel a little bit off balance, significant stiffness and restriction, and most commonly first thing in the morning, because when we're sleeping, that's when our body's recovering. We wake up in the morning, we feel where the body's been repairing, and we can feel it deep within the joint, bit of movement, and sometimes it eases. Sometimes can be worse for weight bearing into the joint, and that is why when people get it, they think, oh, I'm just going to stop and rest and just settle and let my joint just rest for a moment. And actually it's a lot worse when we do that, because although it feels comfortable at the time, if we're not moving through the joint, we're not lubricating the joint surfaces, which means that it can feel more sore, almost staggering as we go to move after, a little bit of joint locking and instability, and then therefore those symptoms can progress and become more severe over time. So like we said, very, very diverse. I've taken this picture and you can see the link below from Wikipedia. I really like it because I feel like it's a really good demonstration. It just shows the main areas of where we typically see people coming in with osteoarthritis. So lower back, hips, knees, definitely. So the weight bearing joints, hands, obviously using our hands all the time and thumbs, and then up into the neck as well. Risk factors, like we said, obesity, trauma, injury, high impact sports, physical work and lifting, and repetitive movement. If you're doing something repetitively over and over, it puts excessive pressure through that joint. Over time, the body has to adapt to this. Long-term management, what do we need to look at? We need to determine why it started. So what are your specific triggers? Have you had an accident in your past history that you never had any rehab for? Your body just powered on, we took painkillers and carried on? Is it that, you know, we've had repetitive postures or repetitive positions or certain things that impact the body day in, day out that might be loading the joint in a certain position? We then need to determine the severity of the symptoms. How are your symptoms progressing? Is it that it needs potentially some hands-on treatment and advice, or do we need to kind of determine the severity, i.e. send off for imaging, have a look into the joint and see if any other treatment is required? Like we said, determine triggers and risk factors in the workplace, outside the workplace, and then creating a plan of action. So case example here, really quickly, giving you an idea of what we see in clinic. So I've got David, 55 years old, working as a plumber, 5 days a week. He loves cycling, absolutely obsessed with cycling, doing that all the time, walking the dog. He's noticed that even though he's walking and cycling, he's starting to notice that his right knee's getting really sore and swelling's occurring around the joint. He's tried ice packs and painkillers, but only giving short-term relief. So on the one hand, what David's doing is fantastic. He's moving the joint, he's walking, he's opening up through, he's stretching, he's doing all the right stuff. What I would home in on here is the fact that when he's working as a plumber on chatting, we can see he's putting a lot of excessive pressure through the knee. So he's kneeling for hours and hours during the day. That's adding a lot of pressure. So what we would look at is obviously any hands-on stuff that we can help if appropriate, but also seeing if we can get David moving during the day. So maybe adding a little bit of support under the knee when he's kneeling, getting him to move every hour and open up through the joint or go for a little walk, or adding in the stretches during the day when he's working, and seeing if that can help to adapt and change the progression of symptoms. So quick run through, what can you do to help? So inside the workplace, looking at your responsibilities, what do you do day to day? What are the stresses being applied on the body? How many breaks are you taking? Have you got support in place in the workplace that enhances your physical well-being? So anything that's in place already that can help you reduce the load through the joints of the body, keep you moving, regular breaks to stop that pattern of tightness from forming. Same outside the workplace, what are your favourite activities that you love to do? Any stretching, movement, strengthening? Are you setting yourself some time to recover after you've been working, to reset through the body? So thinking about what you can do day to day at work and outside of work. And then finally looking at a couple of other things, so the happy triad. So I've touched on this loads of times before, and it's looking at the idea of hitting all elements in terms of keeping your body moving. So cardio, you're moving through the joint, you know, you're increasing your cardiovascular health, keeps you at a good weight, keeps the body moving. Stretching and mobility, it helps to relax all that tension around the joint. Like we said, the symptoms change over time, but you're stretching and moving, lubricating joint surfaces, and then the strengthening just protects the joint. If you can strengthen the muscles around the joint, it takes the pressure off, helps you move, helps it recover, and then long-term feels a lot better. And then finally, just a little reminder, creating a long-term plan of action, owning your past history, understanding your presenting signs and symptoms, understanding your workplace impact on you, so how your working environment impacts you, and any triggers outside your working environment. So I hope you enjoyed that. Like I said, a little taster of what we're doing with Osteo and Physio events and all the stuff that we're creating. really passionate about getting this information into the workplace, getting people to understand their bodies, understand what they can do, so that long term they feel fitter and stronger. So any comments on any other topics you want us to cover, let us know, comment below, and have a fantastic Wednesday.